Hey everybody, welcome to Friends for Life new series that's going to be coming out every Monday moving forward, Medical Mondays, and we have Dr. Craig Escude, who has been on our podcast before. He's going to define some terms and talk about some pertinent issues in the field of developmental disabilities. So we hope you like this new series. Let's dive right into it.
Hello, I'm Dr. Craig Escude, President of Intellectability, formerly known as Health Risk Screening. Welcome to Medical Monday. On today's Medical Monday, we're going to talk about something that is that we talk about a lot throughout in the country today, and that's COVID-19. We're going to talk about how it affects people with disabilities and how it affects them just a little bit differently. There have been some studies over the past year relating to how COVID affects people with disabilities, and one of the findings is that we see that people are at more risk. People with disabilities are at more risk for getting COVID. There are some reasons for that. Some of the reasons are because many people with disabilities rely on the support of others to help them through the day, to get through activities of daily living, and to be interactive in society. And because of that, it's harder to have social distancing. They may require the support of family members or paid supporters, and these people come in and out of their homes, which can increase exposure. Also, some people with disabilities may have a little challenges. They may be a little challenged in participating in social distancing, in things like hand washing, mask wearing. I mean, I don't like wearing a mask. Sometimes people with disabilities have trouble with wearing masks as well. And some of the other preventative measures certainly can increase the risk of a person getting COVID. But let's say a person with COVID a person with disabilities gets COVID-19. One of the things that we've seen in some studies that have been done is that people with intellectual and developmental disabilities are at a higher risk of dying from COVID-19. There have been studies that have shown anywhere from a 2 to a 4 times higher risk of death than people without disabilities. And that's important. That's something that we need to pay attention to and be aware of. Now, the obvious question is why? Well, one of the reasons why is because risk factors that we know that cause an increased risk of death include things like obesity, diabetes, high blood pressure, and we see people with disabilities have a higher incidence of these chronic health conditions. So they're at higher risk because they have a higher incidence of health conditions that put them at risk, including things like lung disease as well. Some people with disabilities might have physical problems and might have difficulty expanding their lungs completely because of body changes and changes in their body function and respiratory function. So all of these things increase the risk of having a poor outcome if you get COVID. There's a couple of other things, though, that I really think play a role. It's really, really important for anyone who supports people with disabilities to be able to recognize early signs of health destabilization, early signs that a person is becoming ill. And they may look very differently in people with disabilities, because we know that a lot of people with disabilities may not have the ability to communicate verbally. They may not be able to tell you, hey, gosh, my head hurts, my back is achy, all of my joints feel terrible. What you may see are behavioral changes. You may see a person maybe becoming withdrawn, or maybe becoming more agitated because they're hurting or in pain. If they have a symptom of nausea, for instance, they may not be able to say, hey, gosh, I don't feel like eating, I'm nauseated. What they may do is just simply not eat or not drink, or they might even become agitated around times where, they would normally be eating or drinking because they just don't want to. And the only way they can communicate it is by becoming agitated or aggressive. So it's important that anyone who works with the person with disabilities understands the different ways that people communicate. Now, Another factor I think that probably contributes to poorer outcomes in general, including with COVID, is a very sad situation. Something that is very important to me that we work to improve, and that's the fact that there are many healthcare providers out there that just really don't have a good understanding of how to provide healthcare for people with intellectual and developmental disabilities. And I'm sure some of you out there who work in this field may have had experiences that you might call less than optimal relating to healthcare providers and to emergency room doctors, to primary care doctors, to nurses, to other types of people, other types of providers in the field, where they just simply don't understand the different ways that people present with disabilities. And I'll tell you, it's really not because people don't want to help other people. A lot of it has to do with the lack of training. And that's a whole other topic, and we'll probably cover that on another section, on another Medical Monday here. But it's something that I do think contributes to poorer outcomes, and fortunately something that we can improve. So back to COVID-19. We know that the main symptoms we see are things like fever and cough and shortness of breath, but there are a lot of other symptoms that you might see. Chills, muscle pain, headaches, sore throat. A loss of taste or smell seems to be very prominent now. You might also see some gastrointestinal symptoms like diarrhea. But remember that a lot of times people with disabilities may present differently. They may become less interactive or agitated, or rather than being able to express themselves verbally about some of their symptoms. So we need to be aware of what to look for. Some of the severe symptoms would be shortness of breath, chest pain, confusion or irritability. A person doesn't wake up very well. They're hard to arouse. They may have a bluish color to their lips or face that would indicate a low oxygen level. Those types of things are emergencies, and you should call 911 right away. But just remember that anytime a person changes in their behavior from baseline, that's usually an indication that something is going on. Now, it can be a whole lot of different things, and we'll cover some of those things in other Medical Monday presentations. But just know that behavioral changes in a person's baseline are something to take note of and something to let a healthcare provider know about. What do you do if a person has symptoms of COVID? The first thing I would say is try to make contact by phone with a healthcare provider, the person's nurse, a physician, and let them know that this person appears to have symptoms of COVID. If there are severe symptoms, of course, you want to call 911 and they need to go to the emergency room. But if the symptoms are not severe, take the time to make a phone call, because heading off to an emergency room may not be necessarily the best first step to do. It can be challenging in a number of ways for the person. It can also increase exposure for that person, for the supporters, and for other people. So try to make a phone call first, unless it's an emergency. So those are some of the big things to think about with COVID. And we will come back in just a second and talk about vaccine information. Thanks for joining us on this Medical Monday. You can learn more about intellectability and our services at replacingrisk.com.
Hey everybody, thank you for watching our first installment of Medical Mondays. I hope you join us next week and every Monday moving forward. And I hope you get some good information out of this, and want to thank Dr. Craig Escude for coming on and helping us out as well. So we'll see you all next week.